So, good evening, one and all. I'm Shivani here, representing FCCIS India. So, I'm welcoming all of you on this platform where we are sharing the knowledge and developing the forensic community. Here, I will present with the short introduction of our organization, where we are doing the multiple initiatives in terms of enhancing the community, enhancing the knowledge of the forensic knowledge, and we are bringing various talented people on this platform who are sharing their piece of knowledge with us. And FCCIS stands for Forensic Consultancy Crime Investigation Service of India. It's a registered organization and a very reputed organization in India. It's a the organization is having the very much proven records and a having a great reputations. We are developing into the education, doing the research and development into the forensic field. The FCCIS is offering various kind of training and certified training programs, which includes not only limited to the certain areas. We are including all the different arena of the forensic services. It may be related to handwriting, signature, or fingerprint examination. It includes photography authentication, cyber forensic, digital evidences, custom-based investigations. It includes training and certification courses also. The courses are of the different time zone and from the different time limits, as we have the daily, 1 day, 5 day, 7 day, monthly, or full diploma courses also, where we are including the courses related to advanced fingerprint development analysis, cyber forensic and ethical hacking, mobile forensic and cloud evidence handling, biological, toxicological sessions. Not limiting to this, the various courses are related to fundamentals of forensic, cyber forensic, digital investigations, mobile forensic, network forensic and malware, email tracing, etc. The cyber security related sessions includes the foundation courses as well as web application, cyber law policy, digital ethics, dark web investigations, etc. Not limiting to this, we do have the sessions related to the advanced and specialization program, where the students can enhance their knowledge as well as can get the certification related to the quantum cognition and AI in forensic services. Psychological profiling and criminal behavior, the session related to cyber psychology and online offender profiling, forensic linguistic and voice analysis, the research methodologies in forensic science. There are various internship programs where the students are learning real world case handlings. We do assist the students as well as professionals for their career aspects also, where they can enhance their skills. This is how we are providing the certificates. You can see the sample of certificates which our students receive after attending the program, and it's very much a registered organization. These are the various programs which we have conducted very recently. We have a team of multiple the people from the multiple diverse field, wherein the head of the team is who is the leading person and a very renowned personality, Mr. Sunil Kumar. His initiative of this FCCI is a tremendous got the tremendous response not only in India, from the all different time zone all over the globe. We have the community where we have more than now above thousand of people who are attending the programs from the various time zones. Mr. Sunil Kumar is the founder and director of FCCI.India. He himself is an expert of forensic science into cyber security, ethical hacker, and digital forensic specialist. He is very enthusiastic, having the commendable number of years of experience in cyber security and cybercrime investigations. He is his expertise is not limiting to that only. He is into the registry and mobile forensic, certified hacking forensic investigators also. So it's a collective efforts of the team of FCCI in very much guidance of Mr. Sunil Kumar, where Dr. Amit Chetri is there as a digital forensic scientist, quantum cognition sessions he is taking, and he is conducting the various kind of certification training program. Then we have Mr. Prakhar Barasoons, who is cybersecurity professional. Further, it's me, Shivani Gupta, who is an academician as well as forensic expert into the handwriting and question documents. We have Professor Nitin Nishad. He's a psychologist, forensic psychologist, and cognitive neuro specialist. Then we have Miss Manju Mehra. She is a very renowned trainer in India, cybercrime investigation officers, and she is a very good speaker, and has her efforts has been acknowledged by the various judicial officers also. But now, the most awaiting person here, I'm very proud and feeling very obliged to have Madam on the platform. Madam name is Teresa J. David Lynch. Excuse me if I am wrong in pronunciation, but we are highly obliged to have you here on this platform. Thanks a lot for that you have given us time to share your knowledge with us. To I have seen your profile. You have rich experience. The short introduction I would like to give you. Madam Lynch, native of North Decton, it's a geobison, the founder of CEO of InterRapid Forensic Healthcare Consulting, a very dynamic consulting firm dedicated to forensic analysis of criminal cases involving abuse, sexual assaults, and other medical issues, providing expert testimony and educational offering located in Converse, Texas. With more than 20 years of experience of nursing experience, she holds a master's degree in nursing and is board certified in advanced forensic nursing and adult adolescent sexual assaults nurse examinations. Madam is also a 20-year veteran of the US Navy with a military nursing background in medical surgical nursing, couple care, ambulatory surgery, education and training, and forensic healthcare. While an active duty, David Lynch, ma'am, was a tri-service sexual assault medical forensic examiner, trainer, and expert forensic nursing consultant for military courts, martial proceedings in all military branches. So, madam is coming from a very rich background. We are highly obliged to have you here on this platform, ma'am. We are welcoming you with wholeheartedly. Madam is also served as the lead forensic examiner at the Naval Medical Center, Portsmouth, Virginia, and Sexual Assault Medical Forensic Examination Programs Director at U.S. Naval Hospital, Sigonella, Italy. David Lynch currently chair as the Adult Trauma and Domestic Violence Special Interest Group of the Academy of Forensic Nursing. Madam has steadily been engaged in multiple military and civilian organizations, national and community-based initiatives aimed at fostering multidisciplinary collaboration and improving forensic healthcare in response to violent trauma. So, ma'am, over to you. We wholeheartedly welcoming you on this platform. So, kindly do the mic check.
I'm here. Can you hear me?
Yes, ma'am, you are very much audible, ma'am. Ma'am, I will stop sharing my screen, and from here you can share your screen.
Okay.
Ma'am, if you need any assistance, do let us know. The team is there in the backdrop.
Okay.
Yes, ma'am, screen is visible.
Okay, great. So I'm Teresa Devitt Lynch, and you did say that correctly. So thank you. Not a lot of people do.
Thanks a lot, ma'am. I was really hesitant. Ma'am, you can...
Oh, I lost you.
Ma'am, you can minimize your this screen, the side screen where the various screens are. Yes, you can minimize this screen, and you can enlarge the view of your PPT.
Okay, I think I did something wrong.
You just have to click left side, the minus, the minimize. No, where you were earlier.
Let me try this again.
Oh, yes, ma'am, please.
Okay, and then minimize. How do I do that?
So, ma'am, you can go to your base screen. Ma'am, if you will go on your main PPT, there you will see the option to enlarge the view.
I am not seeing it.
So, I think that's fine, ma'am. We can continue.
Okay, sorry about that. I hope you can see it.
Yes, ma'am.
So, as she said, I'm a sexual assault nurse examiner here in the States, and it's 7:30 where I am, so I'm going to be sipping on some coffee as I give my presentation. But I just wanted to, well, for the last 12 or 13 years, I have mainly done consulting on sexual assault cases, domestic violence, assault, strangulation. And one of the things that I've learned through that is that there can sometimes be not necessarily a disconnect between the sexual assault examination and what the forensic scientists get, but maybe an area to improve and understand what each entity brings to the table, because really the forensic scientists do rely on the sexual assault examiner to make sure that the evidence is collected properly and packaged properly so that they can do their job in examining the evidence. So that's what I want to talk about today. Oh, there we go. So I'll just go over a couple of definitions first, and then I'll get into depth in the sexual assault forensic examination. And then from there, we'll identify how the forensic scientist relies on the sexual assault examiner. So in different areas, there might be different terms. So you have a forensic nurse or forensic healthcare provider. These are people specially trained crime. That could be domestic violence, strangulation, assault, sexual assault. But then when you talk about sexual assault specifically, the two most common terms that I've come across, and again, this may vary in different regions of the world, but you have the sexual assault nurse examiner or the sexual assault forensic examiner. So the nurse examiner is obviously a nurse who's trained to provide care for victims of sexual assault. But then the sexual assault forensic examiner could be a nurse or a physician who is trained to provide health care for victims of sexual assault. It's also worth noting that they also perform examinations on suspects as well. And then you have the examination itself. And some places might call it a sexual assault nurse examination, a sexual assault forensic examination, or a sexual assault examination, or a forensic examination. There's many terms, but essentially it's a medical forensic examination on victims and suspects of sexual assault. And it includes a forensic medical history, and we'll go through each of these. It includes a forensic medical history, a history of assault, a head-to-toe assessment, photography, and evidence collection. So the forensic medical history, this is a very abbreviated medical history used to identify conditions or pre-existing injuries, or issues that might impact mainly the identification of injury, but they also could impact evidence collection. So usually you ask about acute or chronic medical conditions, any medications they're taking, if they have pre-existing injuries. So if they skinned their knee or something, you don't want to inadvertently attribute that to the potential assault. You want to make sure that you identify anything that's pre-existing, recent surgeries, or anal genital procedures. Again, that could impact injuries. It also could, depending upon the extent of the injury from those, impact the ability to collect evidence. For women, we're talking about the last menstrual period. So, is blood in the vaginal canal, is that due to the menstrual cycle or is that due to injury? Pregnancy history, especially if they've recently given birth, and then birth control. Now, the history of assault, this has two sections to it. So there's the narrative history and additional specific questions. So trauma can impact memory. It impacts how we develop our memory and how memories are formed during the traumatic experience. So when you ask someone to provide a story, basically is what the narrative history is, a story of the alleged assault from beginning to end, their memory could be a little jumbled. They may not remember a lot of detail in there. So, we ask for clarifying questions and we ask them for additional information through additional specific questions that are asked after.
Excuse me, please. Can I just 1 minute, please? The PPT is not clear. Kindly stop this sharing part. It is displayed over your screen, so we can't see the content clearly. Kindly do the needful. Thank you.
So stop sharing.
हाँ शिवानी मैम, तो मैम का तो हेल्प कर दीजिए ना।
So what would you like me to do?
हाँ, उनको भी समझ में नहीं आ रहा मैम, समझ रहा।
एक सेकंड मैं देखती हूँ।
No, you can share the screen, but it was also displayed, I think, mirroring from the iPhone also. I think somebody has also messaged. Actually, your content or the slide is not clearly visible because this pop icon was there of your iPhone probably.
Ma'am, kindly share the PPT again. Now let me help you. If you can do it. Ma'am, share it again. Ma'am, can you scroll down the black screen, your mobile screen, where you can see the various icon, various people who have joined here. That screen, you can scroll it downside. You can scroll it downside. Yes, you pull it down. Yes, more down. More down, ma'am.
Oh, okay, I see.
Yes, more, ma'am. Little bit more. Yes, perfect, ma'am. Now, Mr. Chaitanya, I think it's resolved. That's
Yes, ma'am. Thank you so much.
Thanks a lot. Thanks. Let's continue, ma'am. It's a fabulous session.
Okay.
Yeah.
Perfect. All right. So asking those additional questions, let me just go back quickly to the narrative history. So it provides the victim an opportunity to describe the incident, but sometimes trauma, like I said, affects how our memories are formed. It can affect the timeline of what happened. So in addition to getting the narrative history, there's also additional specific questions that are asked after that narrative history. Also, another thing to note is that suspects, in order to protect their right to not incriminate themselves, are not asked to provide a narrative history or asked additional questions about the alleged assault.
यस मैम, हो गया मैम.
So some of the additional questions that are asked are the date and time of the and location of the assault, vaginal, anal, oral penetration, whether it was with a penis, a finger, or other object, oral contact to of the suspect onto the victim, or vice versa, and the location. Was there lubrication or condoms used? Was there ejaculation in the location? It could have been outside of the body or inside of the anal or the vaginal canal. Any kind of rough grabbing, strangulation, pinching, and the locations of those. Biting, sucking, licking, and the location of those. Assailant characteristic that helps the police when they're identifying the assailant. And then, did the victim scratch or otherwise harm the assailant? And then any voluntary or involuntary drug or alcohol consumption. And this just helps to get a better picture of the alleged assault itself and to provide a more rounded picture of the event. There's also additional questions asked about activities that the victim underwent. Again, this is not asked of suspects, but these are asked of the victim. So have they bathed or showered? Have they eaten anything, chewed gum or smoked? Have they had anything to drink? Have they urinated or defecated? Have they changed clothing, and which clothing have they changed? Have they used any body wipes or wiped any areas of interest? So if there was a bite mark, did they wipe that area off? If it was a vaginal assault, did they wipe that area off? Did they insert or remove a tampon if they were on their menstrual cycle? And then have they had sexual activity in the past 5 days? Now, the head-to-toe examination, essentially the head-to-toe examination is done in conjunction with identifying injuries, taking the photographs, and collecting the evidence. But it's a visual inspection with the naked eyes and an alternate light source, because as you know, there might be substances that can't be seen with the naked eye. And it guides the history and those additional questions. That is what guides the head-to-toe examination. So if somebody said, they were strangled, then there's going to be, a closer look at the neck area, and there'll be samples collected from the neck area for touch DNA. If somebody says they were anally assaulted but not anally assaulted but not vaginally assaulted, then evidence from the vaginal area would not be applicable, but evidence from the anal area would be applicable. So that's why it's important to get a very detailed history in order to accurately and completely perform the head-to-toe examination. Photography, this is something that the forensic scientists don't really deal with, but it's mainly of injuries. And then sometimes if there's trace evidence, they might photograph the trace evidence as well. Evidence collection. So like I mentioned, this is guided by the history of the assault. Provides information as to where trace or biological evidence may be found. And then the evidence collection, again, is conducted in conjunction with the head-to-toe physical examination. Here's some of the potential evidence that can be collected. So if there was kissing, You might do the external lips. If there was oral penetration of, say the fingers or a penis, then you would do inner oral for evidence. And then they should have them rinse out after collecting that evidence to get rid of any residual evidence that is there. And then buccal swabs for reference DNA. Some places still do blood cards for reference DNA. Some places do both. So that would just depend on the local protocol. Hair combings, fingernail swabbings, scrapings, clippings, any areas of rough grabbing or strangulation, bite marks, kissing, licking, debris from clothing or skin, the clothing itself. If they've changed clothes, then they should be at least collecting the underpants. But if they haven't changed clothes, then they would collect all of the clothing. In terms of the anogenital area, you've got mons, pubis, hair combings. And I do have diagrams a little bit later on to give you an idea of the anogenital regions. External genital swabbings, vulvar area swabbings, vaginal and cervix swabbings, perianal swabbings, anal swabbings, rectal swabbings, penile and scrotal swabbings. And then if there's any substances identified from the alternate light source, they would swab those or collect the fibers from that as well. So the kits, many jurisdictions develop their own kits, or they can purchase pre-made kits through commercial vendors. Either one is fine as long as the kit meets the need of both the sexual assault examiner and the forensic lab. So one of the most important things is you can see, if you look at the picture on the right there, you'll see that it's got the name of it, the time and the date, and then on the bottom it's got the chain of custody. So that's one of the important things, is for either a sticker or for that information to be printed on the box to maintain integrity of the evidence, also to maintain chain of custody of the evidence. Most the boxes also need to be we want them to be compact because of storage reasons, but they should be big enough to hold the items that are collected during the examination after being dried, packaged, labeled, and sealed. For bulkier items, big shirts or pairs of pants, a lot of the times the underpants might fit into the kit, but the other clothing may not. And so with that, most jurisdictions are provided large paper bags to hold the container of additional evidence. So the forms are important as well. You've got the patient consent for not only the examination, but the photography, and then also to recognize that collection and release of the evidence will go to the law enforcement agency. A lot of places, the sexual assault examiner will perform the examination, provide the kit to law enforcement with the chain of custody intact, and then law enforcement agency will submit that to the forensic laboratory. I know in the military, there were certain instances where we would send the kit directly to a storage unit versus giving it to law enforcement. But for the most part, it goes from the sexual assault examiner to law enforcement, who then need to maintain that chain of custody and then get that to the forensic lab. Also, you want to make sure that there's the forensic medical and assault history forms in there. Those are very important. And then body maps documenting injury and other findings. Other findings could include substances found on the body. You might want to have those identified on the body diagram so that it's known exactly where they were found. Trace evidence if there was any vegetation or soil or debris or fibers found on the body somewhere. You could put that on the body diagrams too. A photography inventory list. Again, this is not necessarily something that the forensic science would need to be concerned about, but that's one of the documentation pieces that is important. And then the evidence collection inventory, which is something that is very important to maintain the integrity of the evidence and to make sure that it is accurately accounted for. And then instructions. So ideally, every sexual assault victim or suspect would be examined by a trained sexual assault forensic examiner or sexual assault nurse examiner. But in certain areas, mainly very rural areas that maybe do not get a lot of sexual assault patients, then that may not be an option. So having the instructions included in the kit is very important, especially when you're considering they are collecting evidence and it needs to be collected and maintained properly. So having instructions on not only what evidence to collect and how to do the head-to-toe examination, but how to collect evidence and how to label it, how to properly dry it, and so forth is important. Also in the kits, it's important to have the necessary materials. So having clothing bags for underpants, shirts, pants. At a minimum, having a bag for underpants, the shirts and the pants can go in to paper bags outside of the kit. And then also having the necessary swabs and envelopes for the evidence that is collected. This is important because it decreases the incidence of lost evidence. It also decreases the need for the forensic examiner to go hunting for other pieces of equipment that they may need. So with this, with the fingernail swabs, if there's going to be scrapings or cuttings, they usually come with an envelope for each hand, and then also a small scraper, and then a piece of paper, a sterile piece of paper that the scrapings go onto. And when they're sealed, that scraper goes into it as well. And then they come with, if there's going to be cuttings, it'll come with a clipper too. And then for hair combings, there should be a comb included and another piece of paper so that they can comb over the paper to collect any debris that falls out. And then they would include the comb when they're packaging it up. So if needed, the forensic scientist can examine that comb. So evidence integrity and packaging. So it's important that once that brand new forensic examination kit is opened, because they are sealed when they're not being in use, they come sealed. So it's important as soon as that seal is cracked and that evidence kit is opened, that it not be left unattended for any amount of time. This prevents tampering with the evidence. This also prevents any contamination of the evidence. All the evidence should be dried prior to packaging, and I'll talk a little bit more about this again a little later down in the presentation. So I'm just going to run through it for right now. Evidence should be free of contamination. They should be packed separately, including clothing. I know I've seen instances where a t-shirt and a pair of jeans were bagged in the same bag, which is not the proper way to package them. You want to make sure that all the swabs are packaged in their boxes correctly. You want to make sure that all the envelopes, the fibers or debris get put into the envelopes, the appropriate envelopes, and that they're appropriately sealed and labeled. So this would be a local jurisdiction. I've worked at a few different places, and the way that they were sealed was a little bit differently. These were in hospital settings, so we would seal things with a patient label, and then we would do additional labeling to them. And then inventory. And I mentioned this was one of the forms that is very important in the kit. So all of the evidence should be inventoried during the forensic examination. Chain of custody, it is the forensic clinician, the forensic nurse, the forensic physician, whoever is doing the sexual assault examination. It is this person's responsibility to initiate the chain of custody of the evidence collected. So it's important to them to understand what the chain of custody is and why it is important. It maintains the integrity and the reliability of the evidence, as you know, and it's it's a vital element of evidence collection. So how do the forensic scientists rely on sexual assault examiners? After learning all of that, you should kind of have your gears moving and turning and seeing how what the sexual assault examiner does can affect the forensic scientist. So complete and accurate documentation. This is very important. I've been consulting for over a decade, and I've seen, good documentation, and I've seen poor documentation. And having complete and accurate documentation is very important, because as a forensic scientist, you read the history of the assault, you look at the additional questions that were asked, you look at the activities that were performed since the assault, and that helps you as well. Timing. So currently in the United States, I don't know about other countries or areas, but currently in the United States, most areas are conducting these exams up to 72 to 96 hours post-assault. Often this depends upon the forensic lab capabilities. So depending on, so identifying this time difference or this time frame is a collaboration between the forensic lab and the sexual assault examination clinic, because we want to make sure that we're maximizing our capabilities. And we're seeing now that some areas are actually going outside of that 96-hour post-assault. Some are going to 5 or even 7 days post-assault. And this usually depends on the sensitivity and how the capabilities of the forensic lab to extract biological samples and to extract DNA from the biological samples, and how much of a sample, how long the sample will last on the skin, how sensitive the equipment is in picking up how many cells the equipment needs to be able to create a DNA profile. So it's very important to communicate in this aspect. History of the assault. So the detailed history of the assault, both the questions asked and the narrative the forensic scientist should be reading. This will give them an idea of the best places to find biological DNA or biological samples that may have been collected, the best chances of finding DNA, and the type of DNA. So if somebody was orally penetrated with a finger, then you wouldn't be looking for male DNA through sperm. You would be looking for epithelial DNA. The same thing for vaginal penetration or anal penetration. If somebody is vaginally penetrated but not anally penetrated, then you would expect to see the vaginal internal and external vaginal swabs rather than the anal swabs. And you would use the history to know that the vaginal swabs are the ones that you want to swab versus the anal swabs. If they were not anally penetrated, then that would be a waste of time and resources for the forensic scientists. Oral contact, you might be looking for saliva, and this could be from the biting or the sucking or the licking on either the victim or the suspect. If there was a victim or if there was a suspect examination and the victim said that she bit him on the neck, then or on the arm, then hopefully the forensic examiner would swab that area and look for an injury in that area as well. Swab that area to find saliva from the victim to help support that allegation. If the victim said that the suspect was licking their chest, then you would be looking for swabs from the chest area to see if there's saliva on those swabs to help support that. Again, the timing of it and how long the DNA will last on certain body surfaces. They obviously last internally longer than they do externally. So that's important. It's an important element to understand. And for the forensic scientist, just because somebody said that they were licked on their skin doesn't necessarily mean that the saliva will still be there, depending upon how much time has elapsed. Lubrication, condoms. Some condoms come lubricated, but if a lubrication was used, that could be important because the forensic lab might be able to identify the lubrication that was used. As they find, it could contaminate or seem to be a contaminant of the samples collected. Condoms, those would account for the lack of ejaculate, the lack of male DNA, also the lack of epithelial cells in the vaginal or anal canals. Ejaculation and location. So if they ejaculated on the leg, then you would want to make sure that there was a swab from the leg area that the ejaculate was deposited onto. Did the victim scratch or harm the assailant? Did the victim scratch or harm the assailant? Then we would be looking for fingernail, either swabs. Swabs are the most common form of evidence collected in that area, but you could also get swabs, or not only swabs, but scrapings or nail clippings. Swabs and scrapings are more common than nail clippings in most areas, so those would be what you would be looking for. But then also, you've got to think of those activities that the victim engaged in. So this is also important information for the sexual assault examiner to collect, mainly for the forensic scientist, because this could help to explain why there is minimal or no samples identified if somebody urinated, then there may not be any external genital. There may not be any DNA deposited in the external genital region. Same if they were anally assaulted and they defecated and wiped. They changed their clothing, then there's really no sense in collecting their shirt and their pants, but we would want to collect the underpants to see if there's any drainage from the assault on that new pair of underpants. If they used body wipes or wiped any areas of interest, or if they bathed or showered. So again, we can go back to that bite mark or that licking. If they said they were licked or bit on the neck and they took a shower, well, that could account for the lack of saliva being in that area. Also, if they reported being strangled, or if they report their wrist was forcefully grabbed and they were held down, well, you might be looking for touch DNA, but if they bathed or showered, they could have gotten rid of that touch DNA. So this information can be very valuable to the forensic scientist when they're analyzing the evidence that is collected. Then we get into evidence collection. So you want to make sure that it's properly collected and it's collected from applicable locations. So collecting it from applicable locations brings us back to the history and those additional questions that were asked. So that's why you want to read the history, look at those additional questions that were asked, and then look and see were the proper forms of evidence collected for this particular case. Evidence being properly collected. So trained forensic examiners are trained to, when they're using swabs, trained to fill the swab up, to fill all surfaces of the swab with the sample. But if you get somebody who is not trained, they might not rotate the swabs as they're collecting it, and they might just go back and forth. And so, you snip off a piece of the evidence, and if there's no DNA evidence, not even from the victim or from, the person who is being examined, then you would know that was improperly collected. So it's hard to, other than that, it's hard to identify if evidence was properly or improperly collected, but it is something to keep in mind as you go through the work of processing evidence from these examinations. Or another example would be writing on clothing. So the forensic examiner should identify substances, like blood or dirt. They should identify them, but they should not be circling the area. They should not be labeling the clothing at all. That is something they can identify that and document that. But in terms of manipulating clothing, that is not part of their job. So that would be another evidence of improperly collecting, or another example of improperly collecting the evidence. So again, these are the potential areas. We've already seen this slide, so I'm not going to go through it. But what I want to do is to just show a diagram, because what I have seen is, let me make sure, yeah. What I have seen in the past is that labeling has been improper. So they might, looking at this diagram, if you look at, my pointer isn't showing up. But if you look at the labium majus on both sides, that is considered to be the external genital region. And then the parts in the middle, the clitoris, the vaginal opening, the hymen, those are what is called the vulva. And so I've seen in cases where they've labeled the external genitalia, but they've actually collected from the vulva. And that makes a huge difference because in a case in legal terms in the United States anyway, if you go past the labia majus, if you penetrate past that, it doesn't even have to go into the vagina, but if you penetrate to the vulvar area, that is considered penetration. And so if you're labeling external genitalia as the vulvar area, that can make a big difference in determining the, legal aspects of it. And then, so here's an example of a penis and scrotal area. A lot of areas, some just collect the penis and then the scrotum separately. Some collect the penis and the scrotum together. A lot of that depends on what the forensic lab prefers. Do they want them separate or do they want them together? And then down at the bottom, you've got the perineum. My pointer is gone. But down at the bottom, you've got the perineum or the perianal tissues. So there's a difference in terms of penetration. So the perianal tissues is the tissue around the anal opening, and that does not indicate penetration. However, if the swab is inserted just to the tip of the cotton, just to the end of the cotton of a cotton tipped applicator, that's the anal area, and that would indicate penetration. So making sure that the perianal and anal samples are correctly labeled and identified is important as well, because that's the difference between penetration and non-penetration. Evidence integrity and packaging. And I've talked about some of this. So not being left unattended, that you can't determine. So you just have to trust that they don't leave it unattended at any time. Drying all of the evidence prior to packaging. Obviously, if you receive evidence with mold on it, then you know that was not done properly. Free of contamination. They should be dried prior to being packaged, but the swabs and the evidence should not come into contact with each other. If it is dropped on the floor, it should be labeled as contaminated, dropped on the floor. And then a lot of areas, they will get a control sample of the floor so that the forensic scientist has that control sample of what contaminants are on the floor. And then they should also collect an additional sample from that area of which they dropped. Packaged separately, including clothing. I think I mentioned earlier where I've seen pants and shirts put into the same bag, which is improper because you can get cross-contamination of evidence that way. So each piece of clothing should be packaged separately. All of the swabs from different areas. So if you have the external genital and the vulvar samples, even though they're in the same general area anatomically, they should be packaged separately. And then appropriately sealed. That's based on their local protocol, and that's easy. You can look at the sample to see if it was sealed and labeled properly. And inventoried. And this is another thing I've seen on more than one occasion. I will look at an inventory list from the sexual assault examination that was performed, and then I'll look at an inventory list of what the forensic lab received, and they're not matching. And a lot of the times it goes to the improper labeling of the samples. Or there could be missed samples or extra samples. So you want to make sure that you look at the inventory and see that you're getting exactly what was collected. And then again, the chain of custody, if you're getting this from law enforcement, then obviously you're looking at the law enforcement chain of custody that they use. But it is important to understand that the forensic examiner is the first person to establish the chain of custody for all of the samples that are taken from a sexual assault forensic examination. So collaboration and communication, and hopefully you've seen throughout this presentation areas where collaboration and communication are important. Collaboration in developing the kits, making sure that the kit contains elements that are important and beneficial and essential for both the forensic lab and the sexual assault examiner. Also collaboration in developing the protocols in evidence collection. There might be certain capabilities of the forensic lab that impact the evidence collection of the sexual assault examination clinic. And so that needs to be communicated to them so that they can make sure that they're doing they're doing what is going to benefit the forensic lab and ultimately benefit the victim to, support or refute these allegations. Communication, it's good to give feedback in both directions. If you find things that are mislabeled, certainly tell them. If you find, evidence that is not packaged correctly or that has not been collected correctly, it's good to communicate that back. And then, open that dialogue to get, continuous communication between the entities. And with that, I think I ended just on time. Any questions? And I can stop sharing here.
Anushka Walters has mentioned 2 questions. Can
Okay.
you read on behalf of her? Ma'am, should I read? Hello, do I am audible?
Yes, you are audible.
There is one question. What is the difference between swabbing and scrapping?
Between swabbing and scraping, you're talking about the fingernails, I'm guessing. So swabbing would be taking a cotton swab and just swabbing underneath the fingernails. So if this, I have a pen here. So if this was a cotton tip applicator, like a cotton swab, then they would go through and they would just swab underneath the fingernails to get any debris out. And again, you want them to fill the whole swab area, and they would do 1 per hand. Now the scraping would be, how you have a fingernail cleaner on a pair of clippers. So that would be taking an instrument and actually scraping out, I don't know if you can see this, but actually scraping out onto a piece of paper any dirt or debris that is underneath the fingernails. And then that scraper would be included in the evidence kit so that if you wanted to swab and test that scraper, you could. Hopefully that made sense. I can't hear you.
Ma'am, one more question is asked by one of the participants in chat box. I will read it on their behalf. In case of blood or any biological fluid found on walls and it gets wiped, how do we collect or extract the possible evidence?
I'm sorry, can you say that again?
In case of blood or any biological fluid found on walls and it gets wiped, how do we collect or extract the possible evidences?
Found on walls? Like room walls?
Yes, ma'am, room walls.
That would be a question for a crime scene investigator. We focus on the body, so we don't usually go to the crime scene. We, the patient, the victim or suspect will go to a clinic, and then the examination of the body is done there. So that would be a better question for a crime scene investigator.
Another question is there any testing to know if a male is victimized for sexual assault or rape?
Yes, if they report being anally penetrated, then we would take swabs of the anal area.
So the Purba Das has raised the hand.
Ma'am, I have a question. What are the presumptive and confirmatory tests for seminal fluid and vaginal fluid identification, and how are these tests helping in exactly identifying a suspect or the perpetrator itself?
I'm not a forensic scientist. I know what the presumptive tests are. That's as far as I can go. That would be a question for a forensic scientist that actually does the testing. I do the examination. I submit the samples, and then it's the forensic examiner that tests the samples. So unfortunately, I don't have an answer for your question.
Okay, ma'am, it's okay.
Okay, ma'am, I think all the questions has been answered, I believe.
Okay, great.
Ma'am, I have a question.
Yes.
Ma'am, do you ever face or see false rape accusations? Because in India, it's a very severe matter, and medical report is a major evidence to prove that it is a consensual or not.
Well, that's one thing. Actually, I'm glad you brought that up because that's one thing I forgot to mention. Neither the forensic examination, whether there's injury or even biological, samples, even if there's DNA found, they can't determine consent because consent is a legal term that is determined in the court of law. So that would be, at least that's how it is in the United States. So even if I perform the examination and I find injury in the anogenital region, that doesn't mean that was performed without consent, because you can have injury with consensual intercourse as well. And then even if the forensic scientist finds male DNA in the vaginal cavity, that still doesn't determine whether it was consent or not. So that's why the totality of the evidence provided to the jury, please forgive me. I don't know what kind of trials, if you guys have juries or what types of trials you have there. But the forensic examination and even the results that the forensic scientists get, they might support the story that the victim is telling, but they don't conclude consent or non-consent.
Thank you, ma'am, for the answer.
Yes.
Ma'am, what is the minimum amount of semen or vaginal fluid is necessary to be present in order to conduct an examination?
Again, that's another question for a forensic scientist. I think a lot of the technology now, you only need a few cells in order to identify semen or DNA, which is why it's important for the forensic scientist to communicate with the examiners, especially when you're talking about the time frame, because sometimes, the DNA is going to start to degrade as soon as it's deposited. If it's a vaginal assault, as soon as it's deposited into the vagina, the DNA is going to start to degrade. But the technology has gotten more sensitive, where less cells might be required to identify the DNA. And so honestly, again, that would be a question for a forensic scientist.
Okay.
Ma'am,
Yes.
I'm working in a laboratory, in forensic science laboratory, and we generally saw a drop on a bed, a dry drop on a bed, or a small drop is sufficient for the proving that the DNA is present. It's not like in milligrams or one. A 0.01 milligram is sufficient for establishing that the DNA is present in there.
Interesting. It's very interesting how small of an amount that you can identify from.
Ma'am, DNA can be proved through only a single cell. But the question is that how good is the cell? Is that cell? If it's contaminated, there is no say that a big amount or a small amount. If a single cell have a good quality, then it can be described as a DNA.
Thanks for that information.
Yes, Varun, you're right. Sorry for interruption. Just I'm giving you one information. Varun says absolutely right, because DNA is extract from the hair follicles, and the drop is bigger than the hair follicles. So this is the matter of preservations, how the sample is preserved. And Apurva asked how much sample volume is required for the good analysis. In your slide presentations, you describe the method of sample collections and the protocols. So the Purva Das question is directly related to the volume of the sample. This is the question of Purva. This is my small child. Hey, please shut your mouth. Thank you very much.
Did you have a question, or were you just making a comment?
I'm just making a comment.
Okay. I just wanted to make
Again,
sure.
just because I'm very carefully listen all the interactions or all the discussions. So this is my comment. So Purva question is directly related to the volume of the sample, and Varun says absolutely right, because the sample preservation is very important. In India, we have the 72 hours time frame limit for the sexual assault criminal investigations, and within the 72 hours, if the sample is collected in a proper protocol, we have very strong conclusions. We have very strong evidence and conclusions find out in the laboratory analysis. So 72 hours is the Indian time frame, and in other countries, I don't know, as you described, this is 72 to, I think, more than 72 hours. So it is all the matter of the sample collections, which is very important and crucial step in the investigation and the forensic science. Thank you.
Right.
So another question is from the Karthik Shetty. My doubt is one of the main problem is sexual assault, that is delay of reporting the crime, where most of the evidence related to crime will be tampered. So in case of late reporting of crime, how to proceed with sample collection for best results?
Well, so that would depend on, late reporting. Usually, most of the places in the United States, we go 96 hours out. So if they come in at 96 hours, we certainly will take the history and gather information from them. But because our forensic labs are saying there's little or no chance of collecting of identifying samples after 96 hours, then we don't collect the evidence after that time frame. Unless, of course, they haven't bathed for 2 or 3 days, which is why some of those questions are important. So let's say they say they were assaulted 6 days ago, and now we're on day 6, but they haven't bathed for 3 days. Then maybe collecting some of the, select, especially the internal, the anal or intervaginal samples might be relevant, but to collect from the skin, probably not. So it's all on a case-by-case basis.
Thank you.
Ma'am, I like to add one more thing. In one of my cases, I saw a reporting after 45 days because it's a fake rape case, and they prefer to delay the reporting because if you search the internet or if you search the Google, it will mention everywhere that the DNA will remain till 72 hours. So it's a very common practice to report the case after 72 hours so that intercourse cannot be proved. Am I audible?
Yes. Thank you for that comment.
I think we are done with the question. If anyone is having any pending question, can unmute themselves and ask the question. Shrestha Baheti is having some questions. Shrestha Baheti, would you like to ask the question? So, ma'am, you can go ahead. You can continue.
Well, that's it for my presentation. I thank you very much. You guys all had great questions, and I thank you for attending and listening to my presentation.
Shivani ma'am, can you read Shrestha ma'am's question, please? Because she is not able to put her mic on.
Okay, fair. The question is, in cases involving alleged sexual assault of a male victim with minimal or no visible injuries and absence of semen, what forensic examination strategy, sample collection protocols, and laboratory interpretations can still support or refuse the allegation? And what limitations should be clearly communicated during medico-legal reporting and testimony?
Well, in that case, so obviously, you can have even an anal sexual assault without injury. So even if there was no injury, that does not mean that the anal assault did not occur. Now, as far as the absence of, DNA, was there a condom used? Did he defecate, or did he wipe the area? Did he shower? So some of those things might come into play. And so on the stand or during the trial, a DNA specialist may be able to talk to that aspect of it. So even though, injury isn't present and DNA wasn't found, once they listen to all of the evidence, the jury, I don't know what type of system, we use a jury system here. Is that what you use there? You have a jury that determines guilt or acquittals. But once they listen to all of the evidence, in addition to the medical forensic evidence, then that's how they make their determination.
Thank you, ma'am. So I think it's time to wind up. Very well answered. I think everyone has got the answer of their questions. In fact, I would like to address the vote of thanks now. Ma'am, indeed, the session was very insightful and having the lots of information. We received a very lots of informations. Looking forward for the more such intense and informative sessions from your side. So on behalf of FCCIS, from the whole team, wholeheartedly, I am thanking you and hope that you also had the good experience with us.
I did, yes. Thank you for having me.
Thanks a lot, ma'am. Reciprocating the same. And good evening from the India. We have specific, extreme love and affection for the people who are joining our community from the different time zones. And I have lots of respect for their kind gestures for supporting our mission. Thanks a lot, ma'am.
Thank you very much.
Should I sign off, ma'am?
All right. Thank you. I
With your
will.
permission, I'm signing off here, ma'am. Have a
Okay.
nice day.
Sounds
Okay.
good. Have a good day.
One minute.
Thank you.
I have to put one thing means forward. The solicitor has told to ask madam about workshops, so I will sign off this session.
I'm sorry, I didn't catch that.
Ma'am is asking about if you are planning any workshop or if you want to let us know about any planning of your workshop. If the people are
Oh,
really
sure.
interested. Yes.
Sure, I'd be happy to work with you on a workshop.
Yes, ma'am. Sunil sir will connect you with a mail, so you can redirect there. And thank you, Bhupendra sir and Varun sir, for clearing some doubts. I'm also working in forensic science laboratory, and in this workshop, we will connect you also so that the workshop will be completely held, like collecting and packaging and complete analysis. So we will look forward for that. And as India is focusing on these sexual assault cases, we'll try to put some effort and reach out to the forensic teams and forensic students, so the all doubts are clear and the concepts are clear.
Yeah, I look forward to talking about that and working on it.
Thank you.
Thank you very much. It's a very, very
Yeah.
nice presentation. Crystal clear concept. Each and everything is very precise. Very nice.
Thank you.
And
Thank you, ma'am. Thank you for the
way,
lecture.
your way of communication is very nice. Go with a slow speech. It's a very clear. Thank you very much. Nice day. Thank you.
Thank you. I appreciate that.
Thank you, ma'am. Thank you.
Thank you, ma'am.
Thank
Thank you.
you all.
Excellent session. Ma'am Teresa, it was very nice here listening to you. Thank you. Thank you, organizers also. It was very nice. Thank you.
Thank you. You're welcome.
Okay. Okay, ma'am. So good night, everyone. So let's sign off.
All right. Good night.
Good night, ma'am. Thank you.
Good night, everyone.
Good night, sir.
Good night, ma'am.
Good night. Good night.
Good night, sir. Good night, ma'am.